Is Brandon. I'll be with y'all today. Um, can I have your names?
Okay. Hello, Brendan. My name is Dr. Hamza from Northeastern Nigeria. I'm going to be helping you to make your diagnosis.
All
So,
right.
yeah. So your patient's name is Abdullahi Ibrahim Suleiman, and he's 7 years old.
Okay. So, oh, are you going to be translating between me and them?
Yes, exactly.
All right. So, starting off, I'd like to ask, what is wrong?
Wai me yake damun shi? Tun yaushe? Sati guda? Sai me kuma? Okay. Okay. He's been having this abdominal pain for the past 1 week, with associated fever.
Okay. Does this fever come and go?
Wai zazzabin yana zuwa ya dawo ne ko yana nan ko da yaushe? Okay. The fever has actually been continuous.
I'm sorry, could you say that again?
The fever has actually been continuous.
Continuous. Okay.
Yes, continuous.
So he's had abdominal. All right. Does he happen to have any, did he have any rashes earlier this week?
Wai akwai kuraje ne a jikin shi? No, he
No.
doesn't have any rashes.
Okay. Um, okay, so there he is. All right. Has he had any like coughs or anything like that, or is it just abdominal pain?
It's actually just abdominal pain.
Okay, just abdominal pain. All right. Um,
Would you like them to tell you if he has other gastrointestinal symptoms like diarrhea or vomiting or
yeah.
constipation? Yeah, that's all. So, wai akwai gudawa ne ko no? Okay, okay, okay. He actually doesn't have any diarrhea or constipation with vomiting.
Okay. Any fever at all?
As this fever that has been continuous.
Right. So continuous fever. Okay. Um, I would like to,
Okay,
yeah,
would you like to also ask them how they live, if they have any body of any stagnant water at home, or if their house is surrounded with any bushes, or where their source of drinking water is, something like that? Would you like to ask them something like that?
yeah. I'd like to ask them where they're getting their water from.
Okay. So, wai a ina kuke samun ruwan sha? Hmm? Famfo. Ana tafasawa? Okay. Okay. Actually, they get their drinking water from a tap. That's they have a borehole that usually pumps and they get it from the tap. But they don't usually boil it before drinking. And they have some their house is surrounded with some bushes, but they do not have any collection of any stagnant water around their home.
Could you repeat that last part again? Sorry.
Actually, they don't have any body of stagnant water at home, but their house is surrounded with some bushes.
Okay, gotcha. And can I ask where they're using the toilet at?
Wai a ina suke ba haya kamar yana a toilet ne ko yana zuwa waje ne. Eh, Okay, actually, they have a water closet.
Okay. Um, I want to say this sounds a lot like typhoid fever, so I'd like to run a blood and urine test for
Perfect.
potential salmonella.
Yeah, perfect. So we took a blood culture for typhoid fever, and we are going to be having the results in the next 72 hours. But in the
Okay.
meantime, we did a Widal test for typhoid fever, which was positive. And we also did a blood film that showed 1+ of malaria parasites. And we did a complete blood count that showed a hemoglobin level of 10 gram per deciliter.
Okay.
Yeah.
All right.
So if I will summarize the patient for you, I'd say he's a 7-year-old boy that has complaints of abdominal pain and fever for 1 week. And the source of drinking water is from a borehole that is not properly sanitized. Okay. Then some investigations revealed a 1+ of malaria parasites and positive titers for typhoid fever, and also a hemoglobin of 10 gram per deciliter. So what's the diagnosis?
Well, I'm gonna say he does have typhoid fever. He has.
Perfect. Perfect. Go
Oh,
ahead.
oh, is that it?
Yeah, you can go ahead. You were talking. So,
Um, I want to say he does also have malaria though, since the malaria has the count of the parasite.
yeah, okay, that's correct. So, would you like to prescribe any treatment for him?
Yeah, I'd like to prescribe ACT for the malaria, and then for the typhoid fever, I'd like to prescribe some antibiotics on top of some fever medication to help lower that.
Okay, great. So, wai yana so ya ce yaron yana da typhoid fever da kuma malaria, sannan kuma za a ɗan bashi ɗan antibiotics da kuma ACT saboda malaria ko? Yeah, so I've explained everything you said to your patient, and I don't know if you'd like to add one or two things about some preventive measures in case of future occurrence.
Um, I think for the malaria, oh, do they use mosquito nets when they sleep?
Ko kuna amfani da mosquito net ne? Yes, they do.
Ooh. Okay, then I'm just gonna go ahead and say that they should make sure they're washing their hands usually. They're being cautious of making sure they have clean food.
Okay.
Yeah.
Wai wai yana so to yana wanke hannun shi da kyau, sannan kuma yana yana ana tabbatar cewa ana sa dogayen kaya idan aka fita da yamma ko? Yeah. So I've actually explained everything you said to your patient, and we're so grateful for everything that you're doing for them. And they are also going to try and comply with the treatment that you've prescribed for them. And personally, I like to say that you're very confident and you're composed. I like that. And you should be proud of your performance. Okay.
Thank you.
You're welcome. And you can have a nice day.
All right. Thank you, y'all. Have a good day.
Yeah. All right.